the Department of Health is asking members of the public to be vigilant as it has confirmed 2 cases of cholera in Limpopo. Let's get more details now and speak to Neil Shikwambana, Director of Communications at the Limpopo Department of Health. Neil, thank you so much for your time this afternoon. Is it still just the 2 cases at the moment?
Good afternoon, Bongi. Yes, we can confirm that so far we're still having only 2 cases that were confirmed of cholera in the province. The one that spoke about on the statement, which is the 43-year-old male from Zimbabwe who was admitted at Musina Hospital, and then a 27-year-old male was admitted at Helena, France, also from Zimbabwe, who are believed to have traveled back home during the festives and probably came back with the symptoms. Because you would remember that as early as December, we issued out an alert not only to the public, but also to our healthcare facilities after we learned that there are actually outbreaks in our neighboring countries, such as Mozambique, Zambia, Zimbabwe, Malawi, and others. With an understanding that disease does not necessarily respect boundaries, because people travel in between all these countries.
And Neil, let's talk about the symptoms then that they would have presented when they came to healthcare facilities.
Well, the most common symptom is the severe diarrhea that they actually showed, and also fever and also vomiting. So we're also calling upon our people because what we're saying is that we do not necessarily have to wait until a case is confirmed before we can start treating. If a person comes into our facilities with those cholera-like symptoms, we immediately start treating them like a cholera patient, because if we wait until they just confirm that it is indeed cholera, it might be a little too late for that particular person, because as much as cholera is treatable, you need to diagnose it well on time and also start treating it as early as possible.
So are these 2 patients still in hospital? Because in fact, I know that the 27-year-old man in the Capricorn district was treated in hospital. What about the other patient?
Yes, both the patients were treated in hospital. Okay. The other one was treated at Musina Hospital, just as the other patient was treated at the Helena France Hospital in Capricorn district. They're both still in hospital, but they're very stable, and they're likely going to be discharged anytime from now.
Given the fact that we've seen, reports, Neil, suggesting that some hundreds of cases are also in our neighboring countries, and you've confirmed, just some of the countries as well. What measures are being put in place, particularly at, our borders and everywhere else around those areas, to make sure that people are screened and at the same time we contain the further spread of this disease?
Yes, of course. Working with the Border Management Authority and also the National Department of Health, the WHO and other partners, we are making sure that that kind of work is done at our borders. But most importantly for us, to ensure that in terms of surveillance on the ground was strong, and also facility response up to scratch. Hence, I've already indicated that we've actually given an alert to all our facilities to say we can't afford to be complacent when this outbreak is running amok in some of our neighboring countries. So we need to be as ready as we can for any possible case, because you also remember that even during the time when we had an outbreak in Gauteng and also in Northwest last year, we also had cases which were imported. People who were traveling from that part of town, also moving around, bringing the case into the province, and we're able to deal with them. So because of that experience, and also the fact that we had not actually completely demobilized our structures that deals with the cholera at all levels, we're able to say let's quickly respond to this and do all that we can to ensure that we push back on this catch. But we also calling on our people not to panic, but to remain vigilant, practice those safe hygiene habits, such as washing of hands at all material time, drink clean drinkable water, washing of vegetable, and cooking food thoroughly.
So, Neil, let's then equip, our viewers tonight again, because yes, we've had these conversations, but sometimes we take it for granted because information is important. do they need to have concerns if they were sitting next to somebody, or they in the same area or in the same household with somebody who had cholera? Let's arm them with information on how to deal with such cases and how does it spread.
So basically, cholera, it's a waterborne disease. In the main, it actually moves. You cannot get cholera by merely being in the same place with a person who's got cholera. You need to have actually drank contaminated water, which is contaminated with cholera, or ate something that is contaminated, ingest something that is contaminated with cholera. So the fact that people were actually next to people with cholera does not necessarily mean that they might have cholera. But you would also understand that in some instances, for instance, you have got some areas where the sanitation facilities are not up to scratch, where people still relieve themselves in the bush. So you might find that a person who is actually cholera infected relieves themselves on the bush, and then it's raining now in our province, and then it washes that into a stream that people can drink into. That can be dangerous. So people need not necessarily to stigmatize people with cholera. They need to understand that it's an ingestible, waterborne kind of a disease.
A very important point there, Neil, because sometimes people misconstrue certain things and then they start moving away from people that they should not be. But let me thank you so much for your time.